The best thing about my job is the relationships that I'm privileged to have with my patients. Long-term, meaningful relationships. I'm allowed into their lives and get to know them as well as their families and help them walk through some challenging situations.
The best thing I think about working in gynecologic oncology is meeting patients where they are, right? Seeing someone who's really nervous, upset about their cancer diagnosis, understandably, but then walking them through. What does this mean? What do we need to do? What's our action plan? What do we expect our outcomes to be? And how do we support you through this time? It's that journey with women that I think is really special to me.
I think that there isn't as much awareness about gynecologic cancers as there should and could be. Why exactly, I don't really know, but I think that that's why events such as Sparkle of Hope are so important, because not only do they raise awareness, but they also help raise really necessary funds for research and looking into what can we do to find more therapies and more treatments for our patients that we don't have right now, that we wish we did, that we all wish we had.
I didn't know anything about gynecologic cancer. I didn't know anything until this happened to me. You know, you go for your yearly exams and that's all you think about is it's just a yearly exam. You don't question, question things, and then it happened, and then you start wanting to learn more about it. Why, and what is it?
I lost my wife 10 years ago to ovarian cancer. It was very fast and very shocking. We had 4 days notice from the time that we found out she had cancer until the day I lost her, and had no awareness of anything like that prior to that.
What I think sets apart the Carbone Cancer Center and the Gynecologic Oncology Division in particular is the fact that we've got this really diverse group of providers, whether we're talking about the physician providers, the advanced practice providers, our nursing staff, our MAs, our social worker, our health psychologists, right? We have a good team of people that want to understand the patient as a whole.
We all know fighting cancer is never an individual thing. It takes a community. And the way to fight cancer is to ask questions. The more questions we ask, the more answers we get. And the more answers we get, the more questions it generates. So ideally, we can reach a point where we ask all the questions to reach a point where we actually understand what cancer is, where did it come from, not only how to treat it and cure it, but truly, ultimately, how to prevent it.
Lisa Barolette has been working on some really exciting new ways of imaging ovarian cancer and other GYN cancers in the hopes that we can find these cancers earlier. One of the problems with ovarian cancer is that it is caught at such a late stage. So pretty much all cancers that are highly curable are caught in early stages, with the exception of a few. And so if we could find ovarian cancer at an early stage, it would give us such an opportunity to be able to impact that disease.
So in collaboration with Dr. Barolette, we have now looked at, we are now looking at a molecule or a drug which is FDA approved, but it's FDA approved as an anti-malarial agent. And we found that this, in our studies with Dr. Barolette, we found that this same molecule can also kill cancer cells. And so now we are trying to what we call as repurposing. So it's approved as an anti-malarial agent, but we are trying to repurpose it and try to see if we can use it for ovarian cancer treatment.
In GYN oncology research, first of all, it's important to note that there's been a sharp decline in funding for clinical trials in GYN oncology, and there's many reasons for that. But suffice it to say that I think one of the biggest challenges is to maintain or increase funding so that we can investigate new and cutting-edge treatments for the patients who are afflicted with GYN cancers.
What I think Sparkle of Hope can provide for our division that's currently a need is to support the investigator trials. We've got really brilliant people in our division, and they've got ideas about how do we better care for our patients? How do we treat cancer in new and exciting ways. And so having that seed money for that small trial to then prove their concept, to then ask for larger pools of money, I think is really critical for our success. The investigator trials are exciting and they're new, and they can provide our patients new opportunities and creative ways to treat cancer that currently we don't have.
It's the most underfunded cancer. And so we need to do as much as we can to raise funds and to help our doctors and the researchers, because you never know when someone you love, might get one of these life-threatening gynecologic cancers.
The event is a time to really focus on gynecological diseases and the research and the dollars needed to help with that. It's a fun event, has lots of people that attend and believe in it, has great sponsorship, and I guess it's just exciting to be a part of, to really focus that one time per year on simply that.
I'm continually amazed at the amount of work that goes into Sparkle and the number of people who are willing to step up and do that work for nothing. In addition to the people who've contributed a significant amount of money to help further the cause of GYN cancer research and try to help find a cure for these cancers. So absolutely huge thank you. And I can't, I hope they understand how appreciative my colleagues and I are of their time and their money and their commitment to helping us find a cure for these cancers.
We all look forward to it so much, to be there with our patients and supporters and the families and all of our staff, the nurse practitioners, the nurses. It means so much to us as a community. So it's more than just money. It's the event where we get to come together and focus on how important the work actually is.
I think I really want to thank people who spend their time not just at the Sparkle event but throughout the year really supporting our research. And I mean, we have dedicated patients, dedicated survivors, dedicated family members and friends who are really, through all these years have come to know them, and they have really helped us, they really supported us, and supported not only financially, which they do, and we are really grateful for it, but even the thank yous that I get, at events such as Sparkle or other events that I go to. It means a lot to us, and I am really grateful for their support, both from getting the funds that they generate, but also the friendships that I have now developed with so many people here.
What's rewarding to me about Sparkle of Hope is to see the community members come together to create this great event that supports cancer research in the Division of Gynecologic Oncology. We have women affected by cancer, we have friends of women affected by cancer, we've got husbands of women who passed of cancer. We've got this great team of people that come together year after year, volunteering their time, their talents, their energy to help us move cancer research forward. And that means so much to me. In fact, it revives me year after year to see this event and see the support the community gives our division.
I just want to thank them. We just can't thank them enough. We just can't thank them enough. Like I said, it's underfunded, and so basically we're doing this on our own, because it's underfunded, and so we're out there doing our own event in any way that anyone can help out. It's wonderful. I just thank them so much.
And I think Sparkle of Hope, really provides me that avenue of seeing fighting cancer not in terms of tools and chemotherapies and radiotherapy, but in terms of a community that we come together, have dinner, spend some quality time, laugh and talk, and maybe collect our resources and find what matters the most, not only to me and to patients, but we all as a group in fighting cancer. So I really wanted to thank the committee and the people involved in Sparkle of Hope. This is an avenue that we look forward to every year.